So today we're going to continue our discussion with psychotherapy with cognitive, humanistic, and group therapies. So these are all, again, going to be examples of psychotherapies. Remember when you work with a therapist. So the objective for today is students will be able to identify the basic themes and techniques for cognitive, humanistic, and group therapies. So the first psychotherapy that we are going to talk about today is cognitive therapy. And remember, cognitive therapy is the way that you think and process information, or the cognitive perspective is the way that you think or process information. So their main focus is going to be on the way that you think and behave. One of the more famous types of cognitive therapies is what we call the rational emotional behavior therapy. So the rational emotional behavior therapy. And this was developed by a man by the name of Robert Ellis. And what the focus is for this type of therapy is you identify self-defeating thoughts, so negative thoughts about yourself, and then you attempt to change them. So the way that this would work is action, so you do something, then your belief on that action, and then the consequences of those beliefs or of that action. Evaluation. Does it work? Well, we find that this works for anxiety disorders as well. Specifically, though, we see that it works for depression, substance abuse, so alcohol and drugs, also eating disorders. Eating disorders is very cognitive because you have a distorted thought process. One of the great things about cognitive therapy that makes it a little bit different than others is that they are willing to combine additional treatment approaches. So you may use cognitive therapy in addition to biomedical therapy. They are very willing to combine those types. The second type of psychotherapy that we are going to talk about today is humanistic therapy. And remember, the humanistic perspective is this focus on self-fulfillment, this idea of reaching your highest potential. And so humanistic therapy is going to be focused on that as well. It's focused on self-fulfillment, insight therapy, so where you're aware of why you're doing something, so that an insight to why you're doing something. Working with client-centered therapy, so what we call active listening with the therapist. And then a strong focus on unconditional positive regard. So remember this belief that everybody is good no matter what. However, humanistic therapy very much is focused on the responsibility of the individual. meaning you have to buy into this. If you are not a willing participant as the client, this is not going to be effective for you. One type of humanistic therapy is what we call existential therapy. And this is, I guess, what we call a gestalt type therapy. So you're looking at the whole. Remember, gestalt is taking the parts as a whole. Again, this idea of the responsibility of the individual, you have to be a willing participant. And really, you have to be a willing participant in most types of psychotherapy. They're going to experience in the moment. So you're going to use role playing to resolve issues. And past conflicts. Evaluation. It is not very specific. There's a very general idea here, or precise. So you're not really focusing in too precisely on anything specific. However, the idea of growth and reaching your highest potential and this idea of unconditional positive regard really appeals to most people. The third type of therapy that we're going to focus on today is group therapy. And group therapy is exactly what it sounds like. You work together as a group. The first type of therapy is family therapy. And here you're going to understand family dynamics and address conflict. And you can see that happening in the image below. You work with a therapist to monitor progress and provide support. And at home, the parents and family continue to work on that. Self-help therapy. One example of this would be AA, Alcoholics Anonymous. And this is where you discuss a similar problem. So there's a variety of different types of group therapies. They even happen in schools quite frequently where they group students together that might be going through a similar problem or issue. That would be an example of self-help group therapy. Evaluation, it can be very economical because you're working together. However, it is not very personal and it lacks individualization. So if you need a specific address or issue addressed, this may not be the type of therapy for you. So the overall effectiveness of psychotherapies, do they work? Is it effective? Well, we do what we call meta-analysis, and the purpose of this is to determine the effectiveness of psychotherapy. And what this does is it combines conclusions of multiple studies. So you take a look at a lot of different studies, and then you kind of determine, is this type of therapy or psychotherapy effective for you? Hans Eisnick came up with this idea that's called spontaneous remission. And what this says is, yes, it is possible for a psychological issue or to resolve itself. I don't recommend that if you are struggling, just to think, oh, it could have spontaneous remission. Yes, it can, but not always. So you shouldn't count on that. But if you hear of somebody who just all of a sudden got better, that is not unusual. And yes, that can definitely happen. What we have discovered is behavioral therapies tend to be really good for things like bedwetting, phobias, compulsion, marital problems where you need to work through behaviors. Cognitive therapies are good for depression and reducing suicide. Client-centered therapies are, again, good for mild depression. Psychodynamic can be good for depression and anxiety. However, it is very important to notice that those with less focused anxiety, depression, schizophrenia need more than just therapy. And what I mean by less focused is if you have generalized anxiety disorder, therapy is not going to be effective for you alone because there's a multitude of things that cause anxiety. If you have a specific phobia, like you are afraid of snakes, therapy can be very effective for that alone. If you have depression because you just lost a close loved one, therapy can be very effective for that alone. But if you have generalized depression, you are probably going to need more than psychotherapy. You are probably going to need biomedical therapy as well.